Hey guys, Dr. Eric Smith at Optimal Health Chiropractic, and today I have a very good patient, Alberto. So as you can see, the man lifts some weight too, and he's been having this issue where what we call lumbar radiculopathy. So he's been having this pressure on his lower back that's now wrapping around to the front of his leg. So this is a common condition where when you get a lot of pressure on the spine, some people call it a pinched nerve. I don't really call it a pinched nerve because you're just getting some compression in there, either through the vertebrae themselves or you're getting some compression with the disc. So what we're going to do is actually just get that lower back moving a little bit better. But he's been working out a lot with his jobs and everything like that he's had. He's used his joints quite a bit, so we're actually going to go into a shoulder adjustment, going to work from the ground up with his ankles, his knees, his hips, and everything like that. So we wanted to show you what we do in our office to get guys like him and other people that are definitely had some more either muscle or weight on their back, and that weight might have been if you're in the military, if you have a job that you're wearing a lot of like vests, or even this playing with your kids sometimes, having them on your shoulders and getting that extra compression can cause that. So so mainly on the right side is where you're having that?
Yeah, so it's like from back here and it's starting to wrap around into the groin and down.
Okay, so and then your right shoulder as well.
Yeah,
kind of some pain in there. So so we're gonna have him lay face down, and then we'll go into kind of show you what we do for that. So if you don't mind.
Yeah, this guy pops things on me, had a little pop.
So this is a follow-up visit to when he came in before, and we did a few things with him to get his body used to getting adjusted and such. So one of the first things I like to do with most of my patients with lower backs, just get some movement in there. So by using this table, we're going to get some stretching in there.
Yeah, I can definitely feel that.
So by laying face down like this, a lot of patients' muscles can relax because gravity is not pushing down on your spine. This is what we call getting some flexion in the spine in a safe way. So just getting this kind of warmed up, loosened up in a matter. And then this motion, a lot of people don't get a little side-to-side motion. Your lumbar spine is mainly made to do a lot of flexion and extension, so leaning forward and leaning backwards, and then a little bit of the side bending. So when you try to slide your hand down to your side, or if you have to grab your knee or anything to the side, we try to get that motion, and then a little bit of rotation in there as well, but not a ton. And a lot of this tension stuff can come from your hips being tight, so that's something we're going to work on a little bit with him today. As we checked out his range of motion and such, he does some stretching, but with all the extra work that he does and the things he takes his body through, he tends to get a little bit tighter. Yeah. So he was just saying he has a hard time getting that to open up. There are a few different positions that you can put your back in, like bringing your knees to your chest tends to help a lot with that. It's a lot better than doing a forward crunch. It's going to put a lot of pressure on your lower back. And as we can see, as soon as we try to bring his knees up, how he gets some tension in his lower back. So know we got some work to do there, and how tight his quads are. And he's pretty tight through his thoracic. So we're going to get the adjustment here. A nice deep breath for me. Get all the way out. Good. Awesome. Go ahead and drop those arms to the side there. Get that relaxed. So have you lay on this side and face the wall for me, please. Let's get this lower back adjusted. And drop this leg off, get a little stretch in there. got you. I promise I'm not going to drop you.
Oh, God.
Good job. Let's go to the other side. This one we're going to get a little bit higher into your thoracics as well.
Oh, God.
On your back, please.
I'm trying to save the good one for you.
How's your neck been feeling since I've seen you last?
That one's been fine. It's still like how I tied it off feels like a little loose, but definitely better.
Okay, good.
Oh,
There we go. That shoulder relax. Good.
think that hurt you in China?
A little bit, yeah. So you said you're having some of the shoulder pain kind of through here, right?
Yeah, it just feels weak. So like any presses I do, it just doesn't feel stable.
Yeah, pretty tight through there. So we're just gonna do a little bit of muscle release in there. Yeah. Tight pecs.
Oh, that's intense.
So outside of the adjustments, getting muscle work and getting some of that pressure off the joints themselves is very, very important. So right now I'm just doing some just release of his pecs. So this one through here is what we call pec minor. It's a muscle that's underneath his big pec. As you can see, it's very easy for him to bring his arm this way. So I'm sure he does a lot of pectoral flies and different things like that. He has good range of motion, and even me taking his arm over this way, no big pressure or any big issues. But a lot of times when I see people's shoulders rolled in like that, there's a deeper muscle that's here called your pec minor, and it pretty much kind of attaches underneath the nipple line there up into the shoulder in this area, and it's deeper. So when I bring his arm over, the muscle's actually relaxed and pretty contracted, or it's shortened right there. And now I'm going to lengthen it, and that's where he feels more of that deeper pain. So a lot of times if you have that shoulder pain, check out that muscle. It's really only activated when your arm is in this range of motion in here, and it comes down through here, okay? So we're gonna get into his thoracics, and then we're gonna move into some of the other adjustments here, and we're gonna adjust his shoulder. Roll you to the side here. Good, got that one. All right, let's take a look at these ankles while you're here. Prop this up a little bit.
They've been having some issues too.
So our goal with this is to help him be able to get down to a squat in the right depth. A lot of times when somebody's feet can't go into dorsiflexion, which is this very well, it tells me that it's going to cause a problem up the kinetic chain. So we're just going to get into his ankle adjustment here. Let this relax. Good. Awesome. Let's take a look at these knees.
They're giving me crazy issues. And it's like, this one you can feel a big difference.
In terms of pain or just range of motion?
Pain and like, I don't know, almost feels like it's more separated, like, for lack of a better.
Okay, that makes sense. So a lot of times too, knee pain is going to come from the quads or the hamstrings being really tight, pushing that knee tight and causing more pressure in there, because the knee itself really works like the elbow. It should only really go into extension flexion and then lock out a little bit at the end. But if the muscles are pulling really tight on it, it's going to cause a lot of pressure. So with him, it is this is his femur, and this tibia is actually rotated a little bit that way. So I'm adjusting it to encourage some natural rotation in there, as well as to help out with that. One thing that I kind of like to do is, he had mentioned with some separation, is cause some separation by doing a little kind of move in there that gets the meniscus to kind of seat on there a little bit better.
So I notice when I bend that one a lot, it pops a lot. Like it just just feels out of place.
Feels out of place.
Yeah.
Yeah, that one definitely needed a little bit more help in terms of that. Let's take a look at something here.
It's real tight.
Yeah, you and I are going to do a few things for your hip here. Does that relax for me?
Yeah, it's a little more back.
Relax. Good. Right through there. Awesome. All right, let's get into the shoulder and do some other things for your wrists here.
Oh,
Cool. Take a look at the shoulder. Bring your arm around just like that. Good. Move this arm out of your way. Good. Okay. Good. All right. Let's take a look at that neck again. Try to move it around a big circle. Get a little bit looser.
yeah. It's like slight popping. It's more tight when I bring it forward. But yeah.
So you feel it a little bit more in here.
Yeah, so it's like coming down.
Let's just do one more type adjustment. This is just a seated cervical adjustment. Just going to check out his range of motion first. That was a little restricted through there, so we're just going to let your head relax in my hands. Good, right through him. Drop that head in my hands. Good. Good. Good job. So we're going to do a few more things with him with our physical therapy base, one of which is spinal decompression. Take a look at one of those videos. The goal with that is to get all this loosened up so we can actually get not only some space, but to kind of rehydrate those discs and get a few more things with him. So he's done a great job. This is just the second visit on his road to recovery. And look for this guy. He's going to be making some big moves here in the bodybuilding world. We look forward to treating him going forward. Thanks.